Welcome, everyone. My name is Zan Single. I'm the CEO of Patient Voice Initiative. Thanks for joining us for this webinar, which is our key takeaways from HTAi annual meeting here in Istanbul. PVI operates on the lands of the Aboriginal and Torres Strait Islander peoples in Australia, and so I want to extend my respects to their elders, past, present, and emerging, and also welcome and extend my respects to any elders or First Nations people who are online. In this session, we're going to share a little of what we've heard over the past few days. It's been 5 days we've had here at HTAi in Istanbul. I also serve currently as the president of HTAi, being the first to come from a patient organisation. As you can hear from my voice, we've had a very busy couple of days, but luckily for you, the other panelists are made of sturdy stuff and they have pulled up a bit better, so their voices will be a bit stronger. So let me introduce you to our international panel this year. Joining us from Cystic Fibrosis Queensland is Petrina Fraccaro. Welcome, Petrina. Hi, great to have you. Petrina, can I ask you a question straight up? What made you want to come to HTAi's annual meeting?
Yeah, thanks, Anne, and thanks for inviting us to come along this morning. I'd also like to acknowledge that I was funded through the Rare Diseases Interest Group, so I recommend that everybody does consider making submissions and does apply for some of the programs that go, because the support's quite amazing. And for charities, it's cost prohibitive, so it's a great way for us to be able to attend and to participate. So I just wanted to get that out the way. I was really interested because cystic fibrosis lives in that interesting intersectionality between health and disability. So it's often quite challenging for us because we're dealing with HTAi processes through both the PBAC and, of course, the NSAC. Yeah. So I was really interested to see what other organisations do and how, I suppose, in their pathway forward of their progression and where they introduce consumer advocacy in the process. And it is treated quite differently in different countries and how they take patients along with them on that journey and that process. I suppose that was what I was really interested in learning about. And it's a unique opportunity to have so many gifted and talented people in the room at once and who are all willing and able to share.
Oh, that's fantastic, and a great goal that I'm looking forward to hearing how it worked for you at HTAi's annual meeting. And yeah, big shout out to the Rare Disease Interest Group and also the Patient and Citizens Interest Group and HTAi. There's quite a few grants programs around for patients, and we think they're really important. Christine, welcome.
Thank you.
Christine. I was just going to say where you're from, Christine. Christine Mutena is from Rare Disorders Kenya, and I think you're the first person from Kenya on a Patient Voice Initiative webinar. So you're particularly welcome, and we're looking forward to hearing from you. What brought you along to HTAi?
Thanks. And what brought me along, apart from RDG grant, is the willingness to know about HTAi. Back home, I'm a patient advocate for rare diseases, and I realized the only way to actually make a difference in people living with rare diseases from the grassroots level is through policy change. And I thought easy for me to get into policy through HTAi, also through HTA via HTAi, and that for me is mostly why I attended the meeting, because I needed to understand HTA as a new member and also understand the process, meet people, get to see how I can plug all the information I receive in Istanbul back home, so at least I can make a difference for those who cannot or do not have a voice.
That's really interesting. And we often think about in Patient Voice Initiative, we think about the influence you can have in an individual decision about whether something's funded, the influence that's needed across that organizational level about how processes and methods are formed and and even how capacity building happens, and also that influence at the policy level. And so that's going to be really interesting. Our third speaker today is Chris Muñoz. Some of you will remember Chris. Chris is the president of the Philippine Alliance of Patient Organizations, and another hat he wears is his citizens representative on his country's HTAi committee. And Chris, this isn't your first time at HTAi, so what brought you back?
Hi, Anna. Pleasant day to all of you, and thank you for inviting me in this webinar. I think this is the first time I attended a PVI webinar, and it is my pleasure. So congratulations, Anne. I want to thank you. You're really a champion in the patient community. So for this, I think this is my third time, and this is my third PCIG pass also, and I also want to thank PCIG for that. Um, what brings me to HTA? Well, of course, aside from the learning, is I want to give back. I want people to be inspired on what we do in the Philippines. And I mean, I'm very lucky because it is a mandate, right, to have a citizens representative in the council via the legislative process, right? And many countries I see that it is not the same. So some are just tokenistic in nature, and there are really few countries who are really mandated to put citizens in their process. So that's one of the things that I want to do, is that I want to share my knowledge. I want to inspire people. I want patients to build their networks, to see that what opportunities can they make, push their systems. As we say, the topic this year is shaping health systems, shaping through HTA, right? So we want to see that patients would learn from other countries as well. I mean, when I started in HTA, it's also like I'm also like that. So I learned at first, when I first attended, I mean, I learned the very basics. I connected to people, and it's not also about not only attending sessions, attending panels. It's also about connecting with people. And after that, actually, my work doesn't stop, because after that, after every HTI, we also do projects um, with those we have met, like for example, Costello Medical, HT agencies, and it brings real value to my work and what I do, and it brings a better, deep understanding. Back to you, Anne.
Thank you, Chris. And apologies, I've not only got a cold, I have unstable internet. So I'm hoping that this is working okay on your end. It certainly was a really popular meeting. HTAi actually received a record number of abstracts for orals and panels. Even with potential travel disruptions, we ended up having one of our biggest ever meetings. And I felt that we had a particularly strong program with diverse voices. Being here in Istanbul and realizing the way Istanbul really is that bridge, not just the obvious one between Europe and Asia, but a connection to Africa. We saw representation from a lot of areas in strong numbers, not just one person from an area, but strong numbers from around in different disciplines. And I found it particularly humbling to be joined by people currently living in war and working still to provide healthcare. Not everyone who applied could get visas because of this, and we're now thinking within HTAi, how do we ensure we maintain connection and build connection if borders are going to stop us getting together. I had a few more pictures to share. Is that now showing, apologies, the photos from our meeting?
No.
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 Okay, just one moment. These photos are so great. It'd be so worth doing. Just one moment. I will move us. Photos
Yes.
showing up? Great, great.
Yes.
So I've snuck in a few photos of my trip, but I just wanted to give you a flavour of who was there and some of the amazing activities. So thanks to Petrina, those are those of us from the PCIG from Australia in the corner. We did try to get everyone from Australia in a photo, and I think we got about 50%. There was actually a strong turn up. We had a nice night out with the Patient and Citizens Interest Group, which is always a chance to get to know each other a little bit better. There have been workshops, lots of participations in sessions, and there were cats everywhere. I had to have a picture of a cat. I've never been to a conference with cats roaming through before, and they actually turned out to be a very welcome addition. I also took a little picture there because just at our AGM on the final day, we asked our HTAi members what they would like to see us focus more on. And I was really interested to see that patient collaboration emerging in the trend there. I think that's a really welcome sign. So the meeting followed the usual approach, 2 days of pre-meeting workshops, which included that full-day HTAi stimulation workshop led by the patient and citizens involvement in HTAi interest group that I mentioned. And that was held at Barcessa University, which was actually an incredible place on the banks of the Bosphorus. And then we followed that up by a 2.5-day scientific program. And for the first time, we also had an award for the panel, oral or poster, which best demonstrated patient involvement in HTAi. And it was voted for by patients, and the winner received a copy of the new book on patient involvement in HTAi. So we will keep that going now because we thought that was a great way to draw attention to it, and we also to hear more the votes and views of patients. But I want to get back to our panelists now. Chris, you are about to catch a plane, so I want to hear as much as I can before you go. I've got unstable internet, but what did you hear at the meeting that you think is worth sharing? And do you have any key takeaways?
I think, I mean, compared to the first one I attended, I think this one really there are more call out for patient involvement in almost every session, whether it's market access, whether we're talking about health systems, and I believe you know, it's really the time to make sure that those government will ensure that patients will be on board, and they have to put a system in place. And I'm also surprised that I mean I've met a Christine from Africa. I mean I only meet people from the European region, from Asia, but this time I'm glad to see people from Africa also joining this meeting, and it gives a sense that the that patient involvement should be, should not be taken on the side. It should be in the formal process. And one of the things that I mean right now, because I think in every year that you go, your level of understanding deepens. So for this year, my focus was more on the health systems and access, because at the end of the day, we always talk about access for patients, right? And how do we hold governments accountable when we talk about pricing, we talk about access? How do we use HTA to ensure that we still capture the patient voice and at the same time making the HTA process more systematic, more consistent, more fair, and then equitable, right? So at the end of the day, our justification for having those decisions would still make impact on patients. So for me, that was, this year was great. And I'm very interested in health systems actually, because, it's very important. It's not only about the HTA we're talking about, not only about the process, but all those things around it, all the things that we can push. And actually, we are the one who is shaping the system, right? The patients are going to make sure that we push we push the health systems forward, we push government, we push industry so that they will be held accountable. Back to you, Anne.
Thank you, Chris. I'm struggling with my Wi-Fi, so apologies for sometimes a little me freezing there. I find that really, really interesting, and even just noting the role of patients. I noticed that role of patients crossing those silos and being able to connect across stakeholder groups in a different way, in a very positive way. I wondered, was there a particular session that really stood out to you, even if it was one of your own sessions? Because I think you were involved in some really interesting ones.
Yeah, well, the one in of course, the PCIG interest group wherein, everybody was there and we showcase what are we working on. And maybe the other one would be the societal perspective. It's a huge topic for us patients, we're not only talking about the cost, right? We're talking about other factors that, impacts patients outside the clinical care, outside the cost of care.
And
Back to you.
Chris, just for background, in the Philippines, can you tell us, because I know you're going to have to go in a moment, so I'm asking all my questions to you at once.
Okay.
In the Philippines, do you have a process that looks at every treatment submitted, every medicine that's submitted to you, or which we sometimes think of as one that's responding to submissions, or is it that topics are selected on a different basis when you look at HTAi?
Okay. So in the Philippines, we are more systematic. So we want also our decisions would be really consistent. So in everything that, the HTA agency does, it has to have justification, if I may call it. So whether it be a nominated topic, we have a process for that. But right now, we gave that to the Department of Health and PhilHealth so that their nomination would be equivalent to a reimbursement process. So just to have a context on it, because if even if we have a medicine in the formulary, right, it does not mean that it can be reimbursable right away because they have to do a process on it. So we can have a rare disease medicine on the formulary, but at the end of the day, if those two agencies doesn't make any program or any reimbursement process, it doesn't make any sense. So our strategy was to give it to them, making sure that when they nominate the topics, right? So when we have a positive recommendation and they take on it, it will automatically go to a process wherein there will be reimbursement. So I think that's the most important thing. So did we take away the process away from, did we take that process away from the patients because because we let the two agencies? So what we explain is that the two agencies has to have a process wherein patients can also nominate. So instead of nominating it directly through the agency, they go to the two agencies and they can lobby, they can talk about it, and making sure that those agencies would have the same or maybe similar process wherein they take in patient input and they have to hear the voice of the patients and see, okay, what medicines do we really need to um, to put in the formulary. Back to you, Anne.
Thanks for stopping and giving us that explanation, because it's really different to what some people on the call know about, and it's a really interesting process to learn from, and particularly when with your interest in social or societal perspective in HTAi. Now, Chris, I know you have just stopped to talk to us before you have to run and catch a plane. You're welcome to stay online, but equally, I'm happy to let you run and catch that plane. For those of you who are online, we'd love to have your questions in the chat. Feel free to pop them in there. But for now, Chris, I'll say thank you very much for joining us this morning. We look forward to catching up with you again soon. And Christine, can I go across to you now? I know I'm talking without my camera on. I'm trying to hold on to this little bit of internet I've got here. But I'd love to hear what really stood out to you at the meeting and what you'll be taking home. Well, you've already made it back to Kenya, so you're first home. But what you took home to Kenya?
I have like 3 takeaways, actually 4. The first one is I learned how patients can get involved in the HTA process. As I said, I got interested in HTA August of last year. So for me, this was very new, very fresh. But I feel like after the pre-conference from the PCIG interest group, I feel like I've been doing HTAi for years because I learned so much. I got to internalize a lot and see where I can plug in when I work with the ministry back home and the other stakeholders. My second takeaway was how I learned how to position the patient voice with the legislators and other stakeholders so that I'm not coming out as a patient representative who is very pushy, but one who's actually wanting to be part of the process. And for me, having to learn that I learn and get to hear and learn from others ahead of me in terms of don't bulldoze yourself there. These are the tips and tricks of how to talk to legislators. This is what you do without having them build a wall between the two of you. And for me, that was such a very good insight because I don't think I'd have gotten that insight if I hadn't come for the meeting. My third takeaway is both literally and figuratively. I would strongly advise members on the call to read the open access book because this one, I have the physical one, because I think I started reading it on the flight back and I think it's a very good, informative, and the language is amazing. So I don't have to think technically, I don't have to read it with ChatGPT on the side. So I really advise you to read this open access second edition book because I believe, especially for us in the low and middle income countries, it will be a good way to start and learn and slowly teach myself to be an expert from a patient perspective. Thank you.
Oh, I'm very impressed that you were reading the book on the plane last night, because I know you will have been exhausted after what is a very intense program. I know we often kick off sometimes a little before 8 in the morning and we go till late because there's always a huge program that we want to cover, and it will be great to get feedback on the book and how people are using it. One of the strengths of this book is that 75% of chapters have a patient author, and so those patient authors, I think, bring a different perspective and actually really strengthen the way the communication can cross the disciplines of HTAi. Before I go and catch up with Petrina, I saw a question from Trent in the chat. Trent, did not see anyone there from the Australian Health Department this year or from the state departments. That doesn't mean that I didn't miss them, but I didn't see them there. So I think we wanted to follow up to see if anyone had been. We often have had people from the health department there, and we really like to encourage it. We remember in 2023 we had a great attendance in Adelaide, and they even supported all their consumer members to attend the meeting, which, because we believe in the patient involvement, we thought was terrific. But right now, we haven't been able to identify anyone from the department. And when you think about these conversations, I know I have my HTAi hat as well, but I'm really speaking from very much, and probably from both, where I just really believe in the collaboration that's needed. And a lot of the discussion was about this period of intense instability and how do we go forward in it, and collaboration and good dialogue between us was kind of a strong theme there. Now, Petrina, thank you very much for waiting there. It's great to see you there. Petrina is also a patient voice partners, but we didn't bring our patient voice partners to Istanbul as planned this year. We worked with people like Petrina and Kathleen and Robin till quite close to the meeting. Our worry was never about Istanbul. Our worry was people with responsibilities back in Australia with disrupted travel. Petrina had already some other obligations over here, and Rare Disease Interest Group had also made her an offer. So what we've said to our patient voice partners after a bit of discussion was we will hope that transport across the world is much safer next year, and we will make up that opportunity to them. But with people with caring responsibilities, the level of disruption we thought we might encounter meant that it wasn't in the spirit of the Patient Voice Partnership to bring them this year. So Petrina, with that, it was so great to see you here. What are you taking away?
Yeah, I suppose there was two areas that I was particularly interested in. The first is AI and the second is health economics. And what I liked was that in conversations around AI, there was always the two perspectives. So there was we use the word consumer in Australia, but patient's probably more appropriate. So the patient application and then the pharmaceutical. So I thought that was quite interesting as well. And around building capacity and also working on accuracy, because of course, and how do they deal with misinformation out there, and how do we balance speed with equity? I found that quite an interesting sort of conversation and topic, and how that pharma can actually work in with patient groups to ensure that the quality of information that's being posted to AI through the aggregators is accurate. I found that really quite interesting, and it does make sense to me, and I was pleased to see that people were looking to move in that direction and sort of and where next, and also about how it can increase capacity, particularly for lower middle income countries as well, because I think often you do work in a bit of a bubble and you sort of know what's happening in your own backyard. So I thought that application was really interesting. And the second piece is health economics, which is a particular passion of mine, because I believe, particularly in Australia, that organisations that deliver support and services and fund research, such as the organisation I represent, we have we support, I suppose, the health economics of the country. So if we didn't operate, then the cost to government for the services and support that we deliver and for the research that we fund, because it does make quite substantial changes to society. So I'm always interested in health economics. My big takeaway for this was when I see health economics, I see it through my lens. So I'm always focused on patients and community. And I went to some sessions that actually talked about how AI can be used to deliver health economics and cost savings and improve capacity for the health sector, right down to even time-saving devices for nursing. And how do you then translate that time? Because saving time means different things to different people, and you can't necessarily assume it's going to mean an increase of capacity for a patient. What are some of the other things you could be doing with time saving? And so they talked about education and development. I found those sessions really interesting because I liked that it was perhaps taking a different focus and a point of view from what I would always sort of be drawn to, which, as I said, is always around patient advocacy. And then the other session that I absolutely loved was the second plenary, I think it was, Anne, when we had the guests from America talk about the systems in the States, which I think anyone that works alongside pharmaceuticals in Australia is fascinated with what's going on with the most favoured nations, because we really don't know the full impact of that as yet. So it's really hard to have conversations around something when you actually don't know the boundaries and parameters and what's being established, if anything. For me, I suppose the important things that we need to remember is it's a democratic policy that's been adopted by the Republicans. So it's highly unlikely it's going to go away. We just don't know the extent of the implementation and the impact it's going to have on us, really. And I suppose, like a lot of people from countries that have strong government-funded medical systems and support services in place, not just through Medicare, but also through our own HTAi process, we can often be a little bit critical of America. And I really liked how he talked about the access to market that they have and the quick turn and the speed. Yes, of course, it's expensive and it often costs the patient more if they don't have insurance. But I think it's important to remember that all systems have something good about them, and not always to assume that every system, either has to be perfect or it's broken, that there's always that middle ground, and we can learn from each other. It'd be wonderful to be able to cherry pick and take some of the highlights and the success of the American system and put it in a government funded system like ours that didn't have the delays. So, I just think I like those sorts of conversations. I like conversations that make people change their minds, which is what I also liked about Plenary 3, how even some of the panel was sort of saying to each other, but now that I've heard you, I've actually changed my position. I like those sorts of conversations. So I think they're my sort of top tier takeaways. Mm.
Oh, that's great. I agree. Plenary 3, which for the Australians on the line, featured Tracy Merlin from Adelaide HTAi, who tried to do, I think she was very clear with her caveats, and a bit of an exploration to try and see different measures you might try and use to see whether HTAi was having the impact intended. And I think that really was quite thought-provoking. And also, I guess, one of the other themes coming out of the meeting is that the opportunity now for HTAi to better measure impacts and the amount of focus on that. But also we heard quite a lot that one of the reasons it's not done is because people have the day job of HTAi, and so some of this is underexplored. But we heard a lot of interest in that as well. Something else you said was making me think, Petrina. And I was thinking about you and Christine. You both come, and Chris is the same. The three of you come from really different health systems, really different contexts as for where health is delivered. And I wondered, is it useful to meet patients and I guess in the first place, patients from a health system that's so different to yours? Chris was saying earlier about, often when he goes, most people, there's a large European patient and participation group. We've had a much larger Asia group over recent years, but is there a value in talking to patients who come from a really different setting to you, or is it just sort of a bit frustrating and annoying? And if there is a value, what is that value?
Yeah, that's an excellent question. So the talk that I delivered was actually on the Cystic Fibrosis Global Advocacy Alliance. So that's a program I'm working on with a foundation in the States that are a community-based foundation, so the Bonnell Foundation. And why it's important for Laura and I to have as many conversations as we can is because Laura and I are looking to build an education aggregator platform for countries that don't have mature HTAi systems. So in the world of cystic fibrosis, we have many Southeast Asian countries that don't have newborn screening and don't have carrier screening. So that means that newborns are misdiagnosed or undiagnosed because they don't believe that CF exists. So why that's important to Laura in America and Petrina in Australia is because this was something that I sort of have noticed through immigration pathways, is that I'm having children present at our hospitals. Parents are given a diagnosis of cystic fibrosis, and the child may be 3, 4, 5 onwards, and they are so far behind children in Australia that have access to modulated therapies from birth onwards. So that came out of a conversation that Laura and I had at the CF conference in Europe last year. So it's only been a year. So we've had 2 international forums for our alliance, and what we're trying to do is to educate clinicians and educate multidisciplinary teams around the world to get them to start thinking about, if the child has an inconclusive diagnosis and it's in that bronchiectasis sort of family, then consider a cystic fibrosis screening test. So it's really good for me to speak to other countries around what happens, Anne. So, I mean, that's, once again, that's coming from a very self-centered approach and not a generic approach. But then that's why I've attended HTAi, isn't it? So that I can learn and take knowledge back to my community, to the CF world. So for me, that was really, really useful. And then it's also allowed me to have a connection. So there was a person in the audience who came up to me afterwards, after my presentation. I just can't remember she's from Egypt. She's from Egypt. And she was asking me about how we set this up and how we work through it. So we also have what's called a twinning program, and a lot of rare diseases have twinning programs whereby CF centres in Europe twin with a CF centre in Eastern Europe. So Western Europe supports Eastern Europe, just to sort of help build capacity and help with the training of the MDTs, the multidisciplinary teams. And she was from Egypt, and she said, I love that idea, but I'm from Egypt, nobody wants to help us. And I could sort of say to her, you're not going to believe this, but we actually have a Michigan group that are looking to do work into Egypt because they have some strong community ties. So, that was an amazing outcome from my presentation. Like, that was real impact. And I said to her, I can actually connect you with somebody in Michigan, US, who can perhaps help you work out how to make that connection.
Oh, that's so interesting, Petrina.
I know. I
had never thought that this can be a way that we can help people coming to Australia, new immigrants, actually access care they need, plus also with that network, connect people across to different networks. Christine, what about for yourself? I know it was your first time at our meeting, but you are very much a world-wise person. What do you think? Is there a benefit for you coming from Kenya, connecting with patients from other systems?
Yes, it definitely was. Because first, I need to first emphasize that the Ministry of Health from Kenya did come for the meeting, and for me that was a huge step, because it shows that Kenya is looking to the HTA process. But that said, when I was speaking to one of my colleagues from Kenya, she told me it's good that there's a patient voice, because they can only push so far as a HTA body. But with a patient voice coming from the other side, it gives a different perspective in terms of why it is important for the country to have a HTA process. And meeting other patient advocates in already existing HTA systems is an eye-opener, because I feel like if I have a question to ask, or if I stumble in my advocacy in HTA, I have somebody to look up to who can actually guide me and tell me this is what you can do. And then also they can tell me, this is what we have done to help us. I'm not reinventing the wheel. So I think it was a very good exposure, and I'm glad there were other patient advocates. Even though most of them were not that vocal, I still learned a lot and made enough networks.
It was really interesting, and that ability to back up each other with shared goals in HTAi, and to bring that united voice. We have a lot of differences between us in stakeholder groups and around the world too, but when we find those shared goals as a point to back each other up, that makes a lot of sense to me. That is a really useful way to work. And I recall, Christine, when I met you at the meeting, I was walking into the Patient and Citizens Interest Group, and when I was walking in, it was another woman from Kenya, Phoebe, who was there reporting, and then you jumped up after her. And yeah, for those who weren't there, it was a session, an HTAi simulation, where really, rather than giving people a lecture on how HTAi is done, what we did was actually just broke it down into getting people to think about the different aspects, and starting with what questions they themselves would ask about value. And so I think the patient groups came up with like more than 20, but they really crossed into very similar ideas at times, that the researchers and HTAi body and industry would have been familiar with their terminology, but they also had some broader perspectives. But one of the things I noticed was that it was a really illuminating experience for the people who weren't from patient communities, because they realized, oh, these people know an awful lot. And so that was actually one of the takeaways I had about how many times people came up to me after that workshop to say, they're a really switched on group of patients. And I said, yes, they are. But if you give patients room to speak with their language and to be listened to, actually, you're going to find that there's a lot of knowledge there that you're not hearing. But one of the group there was giving us the takeaway, that their one takeaway, and I hope it was neither of you because I've just forgotten who said it, but their one takeaway was that HTAi is different the way it operates around the world because it's influenced by goals and setting. And that means our patient involvement should look different. And I wondered whether, with either of you, was there something you heard around the way someone was working or wanted to work with patients in HTAi that you would really like to take away for your systems?
That needs a thought.
Shall I give you time to think about that? Because another question I also had, and I'm going to come round. I know that's a surprise one. But the other thing, and I'll come back to that one when you have a chance to think. But the other thing I was thinking was there something there, good or bad, that you heard that surprised you?
And actually, I can answer the first question now. Now I've had time to think about it. There was, once again, it was the last plenary when people were talking about, can we benefit from each other? And to me, I always would assume the answer is yes. And I was surprised that a few people said no. And then the lady from the World Health Organization spoke about work that she did to help train the HTAi system. And it wasn't in Latvia, but it was a country next to Latvia. Anyway, and I just thought that was really interesting. So I suppose around education, Anne, that I think I always think it's a missed opportunity when people start doing things in repetition and working in isolation. So I think there's still opportunity to have more structure around the education process of HTAi systems. And that was all. And I would have thought that anyone that was from an emerging market would be really interested in that. So I don't know, like just reflecting again on the twinning work that we do in the CF world, I don't know if there's opportunities for things like that in the HTAi world. That's all. So that's probably just a reflection that I thought is something that could be done differently within HTAi systems. And then, sorry, what was the question you've just asked now?
Was there anything you took away that surprised you? Or did you hear anything that just surprised you?
Generally, I suppose I'm quite optimistic around HTAi. Once again, I think when you're just busy doing the work and focused on the day-to-day, it's always really good to sort of to step away and to have opportunities to have deeper and more meaningful conversations around patient engagement. And I'm really optimistic for the future. Nobody said we don't involve patients. Like everybody involves patients, just at different levels. And I thought what was really interesting was that we don't all involve patient engagement at the same time and at the same process within HTAi, and that was quite interesting to me. And I could see learnings and outcomes at different stages of the engagement process. And I've always been interested in doing a lot more training with my community in general around that process. So that's something I think I will definitely be doing. I think we're often asking patients in Australia to support submissions. Well, I know I certainly am, to support submissions, and I have a very engaged community that are always supporting submissions. I mean, the PBA seat will tell you they're always inundated with cystic fibrosis submissions from individuals when it comes opportunity for us to make a submission for a new drug. But I think what I need to do more work around is explaining the why and explaining I also teach leadership at university, and we do a what, so what, now what? And I'm not using that framework with educating my community. So that was a big personal takeaway for me, just sort of to explain more to them the value of their contribution. And also another takeaway for me was that an unsuccessful recommendation doesn't mean that the efforts and the work were unsuccessful or didn't matter. I think we often get focused on a yes-no outcome from a submission to either PBAC or to either MSAC, and that isn't actually the correct way to address this or to think about this. So that was a real light bulb moment for me, to sort of not get focused on anything that's too binary, Anne, but rather that just because you've had a no outcome, look at the education, look at the platform that you've raised, and look at the community engagement. So how can you build on that for next time, rather than feel deflated and think, oh, I'm back to the drawing board. It's more around how do you keep the momentum going and what do you do next, and how that it doesn't have to be so binary.
Yeah, that's really interesting. I was involved in some work with PCIG where we collected stories of impact, and from that we created a three-dimensional framework of impact. And I know that there was a really great session, which unfortunately I missed, led by the wonderful Veronica Lopez-Gusset about impact at the meeting. And one of the things I think is important about that, the decision, the recommendation that's given is obviously of enormous importance. So I don't want to take away from that in what I'm talking about. But it also makes it clear that there's all sorts of impacts, positive and negative, that occur for the patients that get involved, and also the organizations. And we think a lot about what an organization has learnt from an involvement and what can you keep building on. Christine, have I given you a chance to think about anything you saw in patient involvement practice? Or maybe it might have been even something that you shared with others that they hadn't heard before.
Truth be told, let me answer the part that surprised me the most. I was expecting a very technical meeting, and I was ready to come with my dictionary and write notes so I can come back and read later. But I was very impressed in how I understood each and every session I attended. So for me, that was a real eye opener. And then something else that really did, and I think this is something I would advise others even before the annual meeting, was I got into HTAi and I got into the mentor-mentee program, and that is what drove me to do the meeting. And I learned so much, and I think I'd advise everyone here if they can't be a HTAi member, because there's just so much to learn from a patient perspective.
Thank you. Thank you, Christine. And I note Haley's questions there, and thank you. Excuse me. I think it's really interesting. We saw a lot of familiar process, but I think there was quite what may have been different that we were seeing was not so much that we were seeing processes that we hadn't seen before, but when that process didn't appear to be more than just asking for input, what I saw a number of times in sessions was either a panelist who was a patient or not, or someone in the audience politely challenge on firstly how it was being used, and secondly how well equipped was the HTAi body to actually be able to take account of what they were hearing. And so I found that encouraging, because it's something we've known for a while, that actually it's about teaching systems how to learn from patients and equipping patients so they can bring that knowledge. But we do still see quite a lot of work presented that is largely input. We saw some interesting impacts from Ireland, where input had been used from a citizen's perspective around some of the new vaccines. And that's something we don't see that much of. But it did provoke quite a lot of discussion about which citizens were in on the work and which weren't. And then we also saw, we still see some of the areas, particularly in the medical devices, HTAi, where qualitative research is really just part of the work. And every time they get an HTAi, they spend time with the patient community, working out what's already known and what are going to be the key questions and how should they do it. But have we seen new organizations doing, have we seen some of our older organizations doing new things? Not so much, but we saw a lot more informed questioning of it this year, which as I step away, I remember things take longer than we need them to take, and that's kind of where we would be this year. I don't know, Christine or Petrina, if there was anything you wanted to add to that.
I've actually added to the comments. Just because Hayley was sort of asking about that, so I actually put in the comments. I didn't come across anything new as such because we are quite a mature market. And then Hayley's second one, once again, I referred to Plenary 3. I found that very interesting. And once again, it was the work from Adelaide University, and that talked about societal outcomes and the health economics outcomes for different countries. Like, so if they had a more access to pharmaceutical, do they have better outcomes? Do you remember that session, Anne, in Plenary 3?
Yeah,
and how
great one.
Where they had a mature HTAi that actually delivered the cost benefits offsets that actually delivered, but it wasn't necessarily based on whether or not they had access to pharmaceuticals. I thought that was very interesting.
Yeah, and always that interesting one around spend and how systems make it actually work, their spend work for them. We heard the keynote speaker from America speak about share an incredible and really tough patient experience, which the first stumbling blocks was seeing primary care, which is a really reminder about always having the strength in your primary care. But she spoke about the fact that she was rightly proud of a system that commits so many health dollars, so many dollars to health. What she wanted was a system that could actually make sure those health dollars were doing what they needed to do. And I think she challenged every perspective in that audience. So that was, I think bits of that will be shared more broadly. I think she got us all thinking, because just as we thought she was kind of on our side, we were saying this, then she said something else which provoked again, which is exactly what I love to hear at those meetings.
But and she also did say that, you know, she was in a privileged position with army level health insurance, yet couldn't get an appointment with a GP for how many months? 11 months or something?
Yeah, 13 months. 13
months. I mean, you know, so that's what I mean. That's why it was really good to have the American speakers in the room, because they're still quite positive about their system and say things like that, which to people like us is terrific.
And my big takeaway and my message always back to the HTAi bodies is you can see all the things you achieve, but often in the community, we see all the cracks. And this is where patients are so important to that organizational knowledge. I was on a panel where we're talking about the organizational aspects in HTAi, and I said, I would really like to see these better documented so that we don't have to keep relearning the same organizational aspects. We know patients are really critical providers of knowledge across the silos of health, because we see when we fall between. And I spoke to some of the things that had happened with CAR-T in Australia, just as an example of how crossing a border creates an issue, or changing a specialist creates an issue, or not having people trained in time so that there's limited areas that can provide a treatment. So I think that really got people thinking. It's not, sometimes people just look at a system and say, well, we wouldn't want that. But Petrina, to your point before, one of the reasons I think I was hearing that you like to come, and Christine and Chris and myself, is because we see things and we hear about pitfalls and what to watch out, and then we take that knowledge back. I'm just going to check one more time if I've got any further questions, and then I'm going to give you, I have it. So I wondered if, Petrina, I'll come to you first and then to you, Christine. And Christine, I'm just going to say to everyone, thank you to Christine. No, it's not a product endorsement, who gave me this incredibly good cup of tea, which gave me a voice this morning. So it's the gift of Christine that keeps on going. But I wondered, just before we wrap up, if there was anything else you just wanted to share, or any last reflection you'd like to make before we end.
I'd actually just want to encourage people to be brave and to make submissions. So I've been looking at attending HTAi for a long time, and Anne has been pushing me. And you sort of think, oh, I don't do anything that's different or special or unique. Or I think a lot of us do that. And Anne sort of didn't even say to me, these are some projects that you should submit. She just said, oh, I don't think that's right, Petrina. Just go away and have a good think about your work. And I did. And I made a submission for 3 orals. One came back, and I thought if I get one, that's great, but I thought I will send through 3 submissions. One came back as an oral submission, and then one came back to do a poster. So I ended up doing 2, which was fantastic. And that's also a really good opportunity, because I'm really comfortable at public speaking in areas that I'm confidence, and that's of course around cystic fibrosis or around what I do at QUT, and this really pushed me out of my comfort zone. And I was actually surprised when I did my oral, because it's quite a big stage when you're sort of up there, and quite overwhelming, and I was actually a little nervous, which is unusual for me, but it was a good thing. And I think it's always really good to stretch yourself and to push yourself a little bit, because I thought, all these people in the audience, you know how you think that, well, they've got all this knowledge and all this experience, and I just think it's a really good opportunity, that's all, to also stretch yourself for your own professional development and for your own leadership. I think that's the benefit of going to things like this. If you're going to go, participate, like jump in and make a submission, get involved. And I also recommend that you go to the interest group meetings. Like, don't sort of think, once again, I've got nothing to say. I think go along to the interest group meetings and hear about the projects that are happening collectively in those particular interest groups. So, of course, I went to Patients and Citizens, and I went to the Rare Diseases. So I just went to the 2. But there's one for medical devices. There's loads. So try to go to those as well and hear the projects that are happening. And I honestly sat in the audience at both and thought, you know what, I could get involved in these. I feel I could contribute. I don't feel this is not a space for me. So they're my 2 big takeaways. Yeah.
Oh, that's fantastic. Yes, and thank you, Claire Stewart, who I need Claire Stewart to follow me around each day with her prompt questions, but she actually does important work. But Claire, HTAi 2027 is going to be Brussels, and it's the dates are 12 to 14, and we'll start promoting that. And we'll also promote the call for abstracts, because I really want to encourage patient communities to put in panel abstracts. We get good representation from patient panels. And if you don't know where to start with an abstract, Patient Voice Initiative is super keen to help, as is the PCIG. Christine, your last thoughts?
Yes. My last thought is that even if I don't know everyone who came for the meeting, I'm so glad that everyone was welcoming and ready to share their knowledge, so that if I have an issue or I stumble and I'm back home, I can easily reach out to even somebody as big as Anne Single, who will help me and guide me. So I like that there was no hierarchy feeling anything, and I felt like I just need to know one person and the rest of my HA journey would be helped. So that was my key takeaway. I was very happy about it.
Thank you. And everyone in Australia just spat out their coffee with the reference to Anne Singo is big. But thank you for making me feel that. Thank you for that comment. And it has been an incredible meeting, and I'm very grateful to both of you. As I said, the next meeting will be in Brussels, That doesn't mean it's all going to be talk of HTA regulation, but I think what's going to be really interesting, one of the things I'm keen to find out is by then we should be starting to understand how patient communities are having an impact in the scoping of those clinical assessments. So the PICO, the population, the indication, the comparator and the outcome. So we'll start to have that. Thanks so much, Trent, for joining us online, and everyone. I'm just going to share my slide. I always want to say a big thank you to our sponsors who enable us to do this, who enable us to bring our patient voice partners to these meetings. As I said, we really missed having our partners at this meeting, and I know it was really tough for them, but we would like to take them when the situation actually works for both them and everyone. So we look forward to bringing them along next year. So a big thank you to our sponsors. I have lost my tag because I just want to show you. Here's one, our next webinar coming up. You can see the QR code on the screen there. I'm hoping my boxes are not blocking what you can see. We have never explored an HTAi on assessing the value of medical devices and human tissue. And we're going to do that with our friends at Hearts for Hearts and the lovely Professor Terry Campbell from the advisory committee in this area is going to join us on the 3rd of July. So if you're interested in that, we're going to hear from Terry, and then we're really keen to hear your questions because it's an area that we haven't talked to before. With that, I'd love to thank you for joining us online. Thank you to Chris Muñoz, who hopefully is rushing to the airport. Thank you to Petrina Fraccaro, who I hope is having, I think she's rushing too, and Christine Mutena. I hope you have a lovely day back home, and thank you so much for sharing with us today.
Thank you too, Anne.
Thank you all.
Thank you. Bye, everyone.
Bye.